Good afternoon. I welcome you all to the second webinar on Advancing Global Nephrology, New Innovations and Trends, organized by Advancells. My name is Dr. Sachin Kadam. I am the Chief Technology Officer at Advancells, and I will be your host this afternoon. Today, I will be talking about nephrology, a branch of medicine which deals with kidney and its associated diseases, and treatment. My main focus will be on CKD, that is chronic kidney diseases, and its routine and futuristic methods of diagnosis and treatment. Kidney are a pair of 12 cm long bean-shaped organ. They lie at the level of your vest on the back side of the body. Every human has two kidneys which lie on right and left side of the spine. The kidney produces urine. The urine flows from kidney through ureter to the bladder. The bladder passes out the urine through urethra. Kidneys have three important functions. They are filtered harmful waste product from the blood and drain out via urine. They balances the level of fluid and the salt in the body. They produce hormones. Kidney works like a water purifier. Every day, almost 180 liters of blood is filtered through kidney to get rid of waste product present in the blood. When the kidneys don't function properly, you might have following symptoms: fatigue, nausea, loss of appetite, skin itching, high blood pressure, difficulty in concentrating, difficulty in sleeping or excessive sleep, shortness of breath. Kidney diseases are caused by many factors, and there are several kidney diseases. Some of them are glomerulonephritis. This is a group of kidney diseases that cause inflammation and damage to the kidney's filtering unit. These disorders are the third most common type of kidney diseases. Inherited diseases such as polycystic kidney disease, which cause large cysts to form in the kidney and damage the surrounding tissue. Malformation that occurs as baby develops in the mother's womb. For example, a narrowing may occur that prevents normal outflow of urine and causes urine to flow back up to the kidney. This causes infection and may damage the kidneys. Lupus and other diseases that affect the body's immune system. Obstruction causes by problems like kidney stone, tumors, or an enlarged prostate gland in men. Repeated urine infection, etc. are these kidney diseases. If we neglect or remain untreated, these diseases can take a severe form of kidney damage, and that will be termed as CKD. So, what is this CKD? CKD, or chronic kidney disease, is defined as a slow loss of renal function over the time. This leads to decreased ability to remove waste product from the body and to perform homeostatic function. In medical terminology, CKD is defined on the basis of GFR. GFR is glomerular filtration rate. GFR is the best test to measure your level of kidney functions and determine your stage of kidney disease. Your doctor can calculate this from the results of your blood creatinine test, your age, body size, and gender. Non-communicable diseases such as heart disease, diabetes, or kidney disease have replaced communicable diseases such as influenza, malaria, or AIDS as the most common cause of premature death worldwide. According to 2010 Global Burden of Diseases study, chronic kidney diseases was ranked 27th in the list of cause of total number of deaths worldwide in 1990, but roses to 18th in 2010, second to that of HIV and AIDS. Chronic kidney diseases is worldwide health crisis. In people aged 65 to 74, it is estimated that 1 in 5 men and 1 in 4 women have CKD. Almost 10% of the population worldwide is affected by CKD. And millions die each year because they do not have access to affordable treatment. Over 2 million people worldwide currently receive treatment with dialysis or kidney transplant to stay alive. It is estimated that number of cases of kidney failure will increase disproportionately in developing countries such as China, India, where the number of elderly people are increasing. In US alone, treatment of chronic kidney disease is likely to exceed 48 billion per year. Treatment for kidney failure consumes 6.7% of total medical budget. Chronic kidney disease can be treated. With early diagnosis and treatment, it is possible to slow or stop the progression of kidney disease. As I have mentioned in my earlier slide, chronic kidney disease usually develops in stages, as the kidney don't usually fail at all once. Instead, kidney diseases often progresses slowly over a period of years. This is good news because if CKD is caught early, medicines and lifestyle change may help slow its progression and keep you feeling your best as long as possible. Knowing your stage of kidney disease is important for deciding treatment. CKD has 5 stages ranging from nearly normal kidney function, that is stage 1, to kidney failure, which is stage 5. Stage 5 requires dialysis or kidney transplantation. If the kidney function cannot be restored and both kidney fails, then dialysis is required. Dialysis is necessary if the function of kidney is less than 10%. Using dialysis function, the kidney is performed artificially. There are 2 major types of dialysis, hemodialysis and peritoneal dialysis. In hemodialysis, your blood is filtered through dialysis machine outside your body. In peritoneal dialysis, a dialytic fluid is flushed through your abdominal cavity, extracting the best product from the blood. Alternative to dialysis is kidney transplantation. You get a healthy kidney from someone who has similar HLA marker to minimize the organ rejection. Medication can help us to manage CKD over the time, but this does not provide any cure. Cell therapy is only method for cure. Stem cell therapy is gaining wide acceptance and importance even in CKD. Use of stem cells for treatment of disease is known as stem cell therapy. Stem cell therapy has advantage over organ transplant and cell therapy as there is a limitation in getting organ donor and need of immune suppression therapy alongside. Stem cells are the mother cells of the body that has the ability to continuously divide and differentiate into various other kinds of cells or tissue. Mainly, stem cells were categorized into 2 broad groups of embryonic stem cells which derived from blastocytes and adult stem cells. In adult, the stem cells reside in almost all organs. Adipose tissue and bone marrow are excellent sources of adult stem cells for autologous stem cell therapy, while umbilical cord derived stem cells are good allogenic stem cell source for treatment. There are over 200 different cell types in the human body, each specialized to carry out particular function or form a particular tissue. Stem cells have the ability to convert themselves into several kinds of cells of a body. Stem cells, when come in contact with specific chemical stimuli secreted by the specific cells, they convert themselves into particular cell type. Also, the ability of the stem cells to travel to the disease organ and home there to cure the disease cell is very unique. As we have seen that CKD develops in stages, if we treat the CKD at early stage, the curing of disease is sure. We can use stem cells for CKD treatment right from the stage 2 till stage 4. Although use of stem cells at stage 4 can give individualistic results, stem cell therapy even at stage 4 is recommended. Stem cells are mainly categorized into adult stem cells and embryonic stem cells, as we have already seen earlier. Adult stem cells, which are also known as mesenchymal stem cells, are generally used for any kind of stem cell therapy. People have started using embryonic stem cells and programmed stem cells, which are known as iPSC or induced pluripotent stem cells, are also used for stem cell therapy. For therapy, doctors mainly use adult stem cells, which are from autologous origin, that is a self-derived stem cells, or allogenic, that is from other individual. At Advancells, we use both autologous as well as allogenic stem cells depending on requirement of patient and doctor's opinion to cure CKD. How stem cells work in CKD? A properly functioning kidney contains about 2 to 3 million nephron cells that are responsible for proper blood filtration. Stem cells, once injected to the patient, they travel to the diseased kidney and start the regeneration process of renal epithelial nephron cells. Our kidney regeneration protocol uses more than 17 distinct types of specialized cells needed to repair the connective tissue, collecting blood vessels, and connective tissue with the stem cells. Mesenchymal stem cells may release proteins that can help kidney cells to grow, inhibit cell death, and could encourage the kidney's own stem cell to repair the kidney damage. While living with kidney diseases, one should always remember early chronic kidney diseases has no signs or symptoms. Chronic kidney disease usually does not go away. Kidney disease can be treated. The early you know, you have better chances of receiving effective treatment. Blood and urine tests are used to check kidney disease. Kidney disease can progress to a kidney failure if not treated properly. Kidney diseases are common, harmful, and often treatable. So what do we mean by common? Between 8 to 10% of the adult population have some form of kidney damage, and every year millions die prematurely of complications related to chronic kidney disease. Harmful, the first consequences of undetected CKD is the risk of developing progressive loss of kidney function that can lead to kidney failure, which means regular dialysis treatment or kidney transplant is required to survive. The second consequences of CKD is that it increases the risk of premature death from associated cardiovascular diseases. Individuals who appears to be healthy, who are then found to have CKD, have increased risk of dying prematurely from cardiovascular diseases, regardless of whether they ever develop kidney failure. Treatable. If CKD is detected early and managed appropriately, the deterioration of kidney function can be slowed down or even stopped, and the risk of associated cardiovascular complications can be reduced. Healthy kidney removes waste and excess fluid from the blood. Blood and urine tests shows how well kidney are doing their job and how quickly body waste are being removed. Urine test can also detect whether the kidneys are taking abnormal amount of protein, a sign of kidney damage. Here's a quick guide to the tests which are used to measure kidney functions. Most importantly, blood test. With blood test, doctors check the serum creatinine level present in our blood. The creatinine is a waste product that occurs or comes from the normal wear and tear of muscles of the body. Creatinine levels in the body can vary depending on age, race, body size. A creatinine level of greater than 1.2 for a woman and greater than 1.4 for men may be an early signs that the kidneys are not working properly. As kidney disease progresses, the level of creatinine in the blood rises. Glomerular filtration rate or GFR. This test is measure of how well kidneys are removing waste and excess fluid from the blood. This is calculated from the serum creatinine level using age and gender with adjustment of those of African American descent. Normal GFR can vary according to age. The normal value of GFR is 90 or above. A GFR below 60 is sign that the kidneys are not working properly. Once the GFR declares below 15, one is at high risk of needing treatment for kidney failure, such as dialysis or kidney transplant is required for these patients. Blood urea nitrogen or BUN. Urea nitrogen comes from breakdown of protein in food we eat. A normal BUN level is between 7 to 20. As kidney functions decreases, the BUN level rises. Imaging test, ultrasound. This test uses sound wave to get picture of kidney. It may be used to look for abnormalities in size or position of kidney or for obstruction such as stone or tumors. CT scan. This imaging technique uses X-ray to picture the kidney. It may be used to look for structural abnormality and the presence of obstruction. This test may require the use of intravenous contrast dye, which can be concern of those with the kidney disease. Kidney biopsy. A biopsy may be done occasionally for one or following reasons: to identify a specific disease process and determine whether it will be respond to the treatment, to evaluate the amount of damage that occurs to a kidney, to find out why kidney transplant may not doing well. A kidney biopsy is performed by using thin needle with sharp cutting edge to slice small piece of kidney tissue for examination under microscope. Urine test. Some urine tests requires only couple of tablespoons of urine. Others require collection of all urine products for full 24 hours. A 24 hours urine test shows how much urine your kidney produce, can give a more accurate measurement of how well your kidney are working and how much protein leaks from the kidney into the urine in one day. Urine analysis includes microscopic examination of urine sample as well as dipstick test. The dipstick is a chemical treated strip which dipped into the urine sample. The strip changes color in presence of abnormalities such as excess amount of protein, blood, pus, bacteria and sugar. Urine analysis can help to detect a variety of kidney and urinary tract disorders including CKD, diabetes, bladder infection and kidney stone. Urine protein. This may be done as a part of urine analysis or by separate dipstick test. An excess amount of protein in the urine is called proteinuria. A positive dipstick test should be confirmed using more specific dipstick tests such as an albumin specific dipstick test or quantitative measurement of albumin to creatinine ratio. Microalbuminuria. This is more sensitive dipstick test which can detect tiny amount of protein called albumin in the urea. Creatinine clearance. Creatinine is a waste product that comes from normal wear and tear of muscles of body. Creatinine clears test compared to creatinine in 24-hour sample of urea to the creatinine level in your blood to show how much waste product the kidneys are filtering out each minute. Kidney diseases are silent killer, which will largely affect your quality of life. There are, however, several easy ways to reduce the risk of developing kidney disease. Keep fit and alive and active. Keeping fit helps to reduce your blood pressure and therefore reduces the risk of chronic kidney disease. The concept One on the Move for Kidney Health is worldwide collective march involving the public, celebrities and professionals moving across the public area by walking, running and cycling. Why not join them? Keep regular control of your blood sugar test. About half of the people who have diabetes develop kidney damage. So it is important for people with diabetes to have regular tasks to check their kidney functions. Kidney damage from diabetes can be reduced to prevented if detected early. It is important to keep control of blood sugar levels with the help of doctors or pharmacists who are aware of happy to help. Monitor your blood level pressure. Although many people may be aware that high blood pressure can lead to stroke or heart attack, few knows that it is also the most common cause of kidney damage. The normal blood pressure level is 120 by 80. Between this level and 139 by 89, you are considered pre-hypertensive and should adopt a lifestyle and dietary changes. At 140 by 90 and above, you should discuss the risk with your doctors and monitor your blood pressure level regularly. High blood pressure is especially likely to cause kidney damage when associated with other factors like diabetes, high cholesterol, cardiovascular diseases. Eat healthy and keep your weight checked. This can help prevent diabetes, heart disease, and other conditions associated with CKD. Reduce your salt intake. The recommended sodium intake is 5 to 6 grams of salt per day, around a tablespoon. In order to reduce your salt intake, try to limit the amount of processed and restaurant food and do not add salt to food. It will be easier to control your intake if you prepare your food yourself with the fresh ingredients. Maintain a healthy fluid intake. Although clinical studies have not reached to the agreement on the ideal quantity of water and other fluids we should consume daily to maintain good health, traditional wisdom has long suggested drinking around 1.5 to 2 liters of water per day. Consuming plenty of fluids helps kidney clear the sodium, urea and toxins from the body, which in turn results in significantly lower risk of developing chronic kidney diseases. The findings of researchers have also said that do not advocate aggressive fluid loading, which can cause side effects, but they do provide evidence that moderately increased water intake around 2 liters daily may reduce the risk of decline in the kidney function. It's important to keep in mind that the right level of fluid intake for any individual depend on many factors including gender, exercise, climate, health condition, pregnancy, breastfeeding, etc. In addition, people who have already had kidney stone are advised to drink 2 to 3 liters of water daily to lessen the risk of forming new stone. Do not smoke. Smoking slows down flow of blood to the kidney. When less blood reaches to the kidney, it impairs the kidney's ability to function properly. Smoking is also increase the risk of kidney cancer by 50%. Do not take over-the-counter pills on a regular basis. Common drugs such as non-steroid anti-inflammatory drugs like ibuprofen are known to cause kidney damage and disease if taken regularly. Such medication probably do not possess significant danger if your kidneys are relatively healthy and you use them for emergency purpose only. But if you are at dealing with chronic pain such as arthritis, back pain, work with your doctor to find out the way to control the pain without putting your kidneys at risk. Get your kidney function checked regularly if you have one or more of the following risk factors. If you have diabetes, hypertension, if you are obese, one of your parents or other family members suffers from kidney disease. So remember, if you treat your kidney well, they will support you to live a healthy lifestyle. Thank you.